You can use putty PVC impression material as moldable material with Easdent tray to record the teeth position, centric relation, and video information. Use catalyst to base 1:12 ratio to slow down the setting of the material. Put the material at the integral side of the tray. Do not put too much material, especially at the lingual of mandibular arch. The amount of material should correspond to the space between the tray and the tissue when the tray is positioned at the ideal position and the jaw is at VDO. When you see the tray, some material might be pushed to the border. It is a little difficult to do the border molding at this stage. You want to focus on the teeth position and the occlusal relationship at this time. Insert the Easdent tray with moldable material into the mouth and hold the Easdent teeth against the opposing arch. Align the Easdent teeth with the correct midline and position them in the most stable and balanced relationship to the opposing arch. Guide the patient to bite at centric relation slowly into the preset video using Easdent measure. You can watch the video how to record centric relation and how to record vertical dimension of occlusion to learn different ways of getting centric relation and VDO. Once the jaw is at the correct position, make sure the patient stay in this jaw position. There might be extra moldable material getting into the buccal and labial vestibule. Use the lip to push away extra material. Then use your finger to press the extra material thin and up to the vestibule area. You can use your finger to press inside the mouth. If the material is a little sticky to your finger, you can also use your finger to press on the cheek to press the material thin and up into the vestibule area. Then use the lip movement to mold the border. It is important to press the material thin. Too thick material will be difficult to be molded by the lip. If working on a mandibular arch, some moldable material may be pushed out to the lingual border. After molding the buccal, gently hold the Easdent tray in position with the arch. Let the patient slowly open the mouth. Use your finger to press the material thin into the lingual vestibule, especially the distal lingual vestibular area. Let the patient move the tongue around to mold the lingual border. By the time the buccal border is molded, the putty PVC impression might be partially set. It might be difficult to mold the lingual border very well. That is why you should not put too much moldable material at the lingual. Putty PVC impression material will self-set completely in about 5 minutes. In case the impression material is set before you get the ideal position, you can peel off the moldable material and redo this step. Now you have a customized Easdent tray with the correct jaw relationship. Since the teeth on the Easdent tray are pre-positioned, not customized designed for the opposing arch, their alignment may not be ideal. The horizontal plane may appear tilted. Only a few teeth may be in contact. The gaps may exist between the arch in a lot of areas. By providing clinical pictures or face scan, along with special instructions regarding the incisal position, midline, and the height and angle of the occlusal planes in reference to either Easdent impression teeth or the opposing arch, the lab can accurately set up the denture teeth. If you're making maxillary dentures using this way, Easdent teeth may not provide the ideal aesthetic outcome. If you want the patient to preview the cosmetic result at this stage, you have an alternative way of doing this. After loading the moldable material in the Easdent tray, sit the tray in the mouth. Align the midline of the teeth on the Easdent tray to the midline of the face. Use Easdent measure to push the Easdent tray in the mouth to align the incisal edge at the correct vertical position to give good aesthetic result with a smile and be barely seen past the lip line at the rest. The occlusal plane should parallel to the interpupillary line. Align the incisal at the correct sagittal position to provide appropriate lip support buccolingually at rest and good aesthetic result with smile. Make a occlusal plane parallel to the ala tragus line. The video, What is the Ideal Maxillary Teeth Position, will help you better understand the principle of ideal maxillary teeth placement. This method may give you a better aesthetic preview. However, Easdent teeth may only contact one or a few teeth with the opposing arch at the centric and VDO. There is a gap between the arches, so the vertical dimension measured with this method will be bigger than the ideal VDO. When you do the final evaluation of the video on the Easdent impression, You have to find the correct amount of vertical reduction for the lab.